y'all, this is Marley K. Hope y'all are well. I have a follow-up to the story that I brought to you from Dr. McCullough about the incentivized sticks. And I think I found a way to be able to talk about it on YouTube without getting in trouble. So what I did was I went to the Centers for Medicare and Medicaid Services, and this is about what they call value-based programs. And it ties into that a story that I was telling you about how the doctors were opting out of this model of healthcare because it incentivized a whole lot of things that were not things that they've had to do in the past, to say it like that. So let's get into this. So this is about value-based programs. So value-based programs reward healthcare providers with incentive payments for the quality of care they give to people with Medicare. They do the same thing with Medicaid, and they do the same thing with other, regular health insurances. You may work someplace that they have a wellness program. That is an incentivized program. They pay the business to monitor the employees, to give you all these services on site, track your healthcare outcomes, and they get a benefit. You get the benefit of not having to go to the doctor per se, and having maybe a nurse practitioner or a nurse on site to do certain things for you, monitor your blood pressure, call you in prescriptions, so on and so forth. Because they are under the purview of a physician someplace locally. But the corporation gets a financial benefit from the insurance provider because they are doing something to keep you from going back and forth to the doctor. It's supposed to be to monitor your health care and improve your outcomes, but it's all tied into this beast infrastructure where they just monitor everything about you. They know who's sick, they know who the weakest links are, and they know who they're going to delete when it's time to delete. I'm just keep it real. I don't even have time to play no games no more. They are monitoring as much as they can. They know who's old, they know who's young, they know who got high blood pressure, they know who got diabetes, they know who got everything, got STD, whatever you got, and you go into these healthcare providers that are tied into these types of programs, even if they're not, just regular insurance companies are participating in this too. So there's no way for you to really escape it except for to only go to the doctor when you actually need it. So again, let me get into this. So these programs are part of our larger quality strategy to reform how healthcare is delivered and paid for. Value-based programs also support our three-part aim: better care for individuals, better health for populations, and lower costs. So at the end of the day, everything is tied to money. And so they don't reimburse well for any government program, or whether it's Medicare or Medicaid. The reimbursement rates for those um, programs are really low. And while a lot of healthcare providers will take them, they only take a certain number of them. Or sometimes they don't necessarily have a limit, but they accept all sorts of insurances and types of patients because these are the lowest paying patients or reimbursements. And usually these people have more health issues or are required to do more. Like, if you are on Medicaid and you got a baby, you got to do baby wellness. And so there's a bunch of things that you have to do, and it's all in the electronic health record system. So you can't skip it. And the provider is required to ask you or offer you these things or tell you you have to have them, or maybe they're tied to something else like school for kids. Um, or being able to go to child care. If you got to go to work and you need to send your child to daycare, then the daycare requires that the child has these, and these are required by state law. And so it's just a whole system, but it's tied into a lot of other things. So when you go to the doctor, don't necessarily think that they're advising you always on the best thing for you. A lot of times this stuff is tied into some bigger agendas. So why are value-based programs important? Our value-based programs are important because they're helping us move toward paying providers based on the quality rather than the quantity of care they give us. Excuse me. So, like in the article, that I gave to you from Dr. Mercola, where he talked about um, the physicians being incentivized to push sticks. This is the same type of thing. While they say it lowers cost, even if they pay the kickback to and I hate to say kickback, but if they give the incentive to the physician is thinking about their bottom line, how much more money they could make. Like they may make a little bit by seeing poor people who um, use these insurances, but at the end of the year, they get a bonus for doing XXX thing in accordance to the way that the insurance company wanted them to do it. What are CMS's original value-based programs? So there are 5 original value-based programs. Their goal is to link provider performance to quality measures to provider payment. So check this out. End-stage renal disease quality incentive program. So this means people who are on dialysis. Hospital value-based purchasing program. Hospital readmission reduction program. So they get incentives to not readmit you into the hospital, or incentives for keeping you from being readmitted to the hospital. And so when you have non-compliant people who don't follow instructions, it reduces the amount of money that hospitals can get back. But it also harms doctors because doctors also get a bonus from this as well. Value modifier program, also called physician value based modifier, or PVBM. And so this is the thing where, Dr. Mercola was talking about the physicians. And then hospital acquired conditions reduction program. And so that's when, you go into the hospital for something and then you get sick. They done gave you an infection or they messed up something. And you went in for one thing, but they gave you something else. And so then the insurance company is like, how did this happen? So that happens a lot with poor people because just, people don't always give the same attention to people who don't have means, the way that they do give to people who do have means. So they have incentive programs for that. Are there other value-based programs? Yes. Skilled nursing facility value-based purchasing. So they give incentives to nursing homes to buy or not to buy certain things for, like when you go to rehab. And then home health value-based purchasing, same thing for these home health programs they have where people go out to people's homes. They usually have like a set limit of things that they offer to people. And then, the goal is to try to encourage people to follow whatever the model is that the home health care provider wants them to follow, which is usually a directive from Uncle Sam. So here they have a timeline, and as you can see, as I was telling you, a lot of this stuff happened before President Obama was elected. So they passed the legislation, and then they passed ACA in 2010, and that's when everything started changing. So you can look at this. I'm going to include it in the description, but I just wanted you to get a better understanding of what it is. And this is just for Medicare and Medicaid services, but you can go to any insurance company and they all have these programs. Medicaid has it, Blue Cross Blue Shield, everybody got it. So it's helpful for you to understand, when you go to the doctor, and they have incentives. They're incentivized to do certain things, to offer you certain things, to get you to come back or not come back, get you to take sticks or not take sticks, um, encourage you to receive renal care services instead of telling you to take other alternatives. I'll say that. So anyway, before I get in trouble, I'm going to end this video. Please like this video, share it, subscribe to the channel. Please also subscribe to my Odyssey and Rumble channels in the event this channel is taken down. Don't forget to hit the bell notification so that you can receive all the notifications every time I upload a new video. Consider supporting the channel. My Venmo and coffee links are in the description as well. Continue to pray about all decisions for anything that is going into your body, any medication, even, things from your doctor. You may have a doctor that you've been going to for a long time. You may want to have a conversation about, these incentivization programs to see if they participate in them. And, they may or may not disclose it, but at least you will know. But more than likely, if you go to the doctor and they have an electronic health record system, they participate in these value-based programs because that's what they are all about. Now, if you go to the doctor and your doctor still using paper charts and they don't have a computer in the room, they have their own practice, so on and so forth, and they're not necessarily associated with a big hospital system, then you might be okay. But it's still helpful to ask. All right, I am Marley K, and I'm out.